Corset platysmoplasty and choking phobia. Surgeon recommends corset platysmoplasty. Have a choking phobia. Does post-op tightness of corset platysmoplasty feel like choking? Is this procedure typically done under general or local anesthesia? Doctor uses a certified registered nurse anesthetist and not a medical doctor anesthesiologist. Is this okay?
Thank you for your question. You submitted your question with a single photo focused on your neck from the front view. And you're stating in your question that your surgeon recommends a corset platysmoplasty and you are concerned about a choking phobia or the perception of tightness and a choking feeling after a platysmoplasty. You're also asking whether or not this procedure is done typically under a general or local anesthesia, as well as a question about whether it's safe to have this done with a nurse anesthetist as opposed to a medical doctor and anesthesiologist. Well, certainly I can share with you my personal approach in helping my patients understand the pros and cons of both the surgical approach as well as the type of sedation that's optimal. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people with aging neck and improve the appearance of their neck and face has been a significant part of my practice for the duration of 20 years, with continuous evolution of this very, very challenging area, which is reflective of the many different elements that it takes to try to get the best result possible for an individual patient. So to begin with, let's understand a little bit about what the purposes of a corset platysmoplasty. Now, in my practice, generally speaking, I rarely do a corset platysmoplasty as an isolated procedure. And the reason is that the goal is to certainly improve the neck contour by defining the area between the chin and the neck angle, as well as the overall sharpness of the side view of a neck. However, generally speaking, at the same time, there is laxity and sagging of the facial tissue, which means this is often done in conjunction with the facelift. And if there is a significant amount of extra skin, then it's also done in a combination with the face and neck lifting procedure. So, and in terms of using those particular words and terminology, there are many ways to do all those procedures. Now, specifically, one of the challenges of helping people with the platysmal bands, which is generally one of the indications for a corset platysmoplasty, is that whether you're using different types of suture material and the techniques in which you close the platysma that's divided and various types of maneuvers to maximize the result, there is the possibility of a tight feeling. I would say that it's very rare for someone to really feel like they're choking, but it is certainly possible to feel a tightness. You can certainly discuss this with your doctor, who can share with you their experience and what they generally find. I think that one of the things to at least understand is that even though things are done very tightly during surgery, the tissue has a natural relaxation. And what that means, of course, is that the muscles stretch a little bit, the skin stretches a little bit, and so with time there is what I call an equilibrium that ultimately settles out. So things that are maybe tight in the beginning tend to stretch a little bit with just facial movement and tissue elasticity. And one of the things to also discuss is, of course, whether or not it's indicated to have another procedure in addition to just the corset platysmoplasty, whether it's a facelift or a face and neck lift. Just as a side note, if you look at the plastic surgery literature, to this day, almost every year there are significant numbers of journal articles about the best way to do facelifting, neck lifting, and platysmoplasty. And well, I shouldn't say actually best ways, but new approaches. So which is, again, as I said earlier, is reflective of the certain degree of the limitations of working with the human body, and how what you do in surgery ultimately settles out over the course of time. Now, as far as whether something is done under general anesthesia versus local with sedation, in my practice we do something called light anesthesia, which is basically local anesthetic, which means making the area numb with local anesthetic like you would like a dentist, and you also get light intravenous sedation. We generally avoid general anesthesia. This is something that's worked out very well for me in my practice and the way we do things. I avoid essentially the many risks and challenges of general anesthesia. My patients are very comfortable and get up and walk away without having any of the often side effects after anesthesia using general anesthesia. So it's really the surgeon's preference. There are many surgeons who prefer general anesthesia versus local and sedation, and they have their reasons, and this is something you should discuss with your doctor. Now, as far as a nurse anesthetist versus anesthesiologist, I think it's, again, important for you to discuss this with your surgeon. I think that every surgeon who has like we have in our practice, we have our own facility, we're certified by the Joint Commission, the staff I work with is very comfortable with me and the way I do my surgeries. I think it works both ways. A surgeon can work very comfortably with an anesthesia provider, whether it's a nurse anesthetist or an anesthesiologist, and so if your surgeon feels comfortable, then I think it's reasonable for you to feel comfortable. And I think that there should not be any particular bias based on this particular qualification. I think experience is critically important, and depending on the relative risk of complications related to anesthesia, that's also an important, important factors to understand. You know, if I feel someone is not a patient that I would feel comfortable with doing in my office facility, then I'll either bring them to a surgery center or hospital, or I'll just not do the surgery. So discuss this with your doctor, since your medical history is not part of your question. So I hope that was helpful. I wish you the best of luck. Thank you for your question.